I am Dr. Laura Moreno, and in this video, I want to talk to you about colon cancer, specifically the warning symptoms the body can give and when testing should be considered without fear, without alarm, and without unnecessary panic. Colon cancer is one of those topics that makes many people uncomfortable, not because it's rare, but because it's often misunderstood and surrounded by silence. And that silence is one of the reasons symptoms are ignored for too long. Colon cancer rarely appears overnight. In most cases, it develops slowly over years. During that time, the body often sends signals. The problem is that these signals are subtle, easy to normalize, and commonly attributed to stress, diet, age, or just how my digestion is. Learning to recognize changes without jumping to conclusions is the key. One of the most common warning signs is a change in bowel habits that lasts longer than a few weeks. This can mean diarrhea, constipation, or an alternating pattern that is new for you. Everyone has occasional digestive changes, but when your usual rhythm shifts and doesn't return to normal, that change matters. Another signal many people dismiss is a change in stool appearance. Stools that become consistently thinner, flatter, or narrower than usual can reflect changes in the colon. This doesn't mean cancer by itself, but it does mean something is affecting how stool moves through the bowel. Blood in the stool is another warning sign, and it's one that causes both fear and denial. Some people see blood and immediately panic, while others see it and assume it's hemorrhoids and ignore it. Blood can appear bright red or dark, and sometimes it's not visible at all. The key point is that unexplained bleeding should always be evaluated, even if you feel fine otherwise. Persistent abdominal discomfort is another symptom that's often minimized. This can include cramping, bloating, gas, or a feeling of fullness that doesn't improve. Many people live with digestive discomfort and assume it's normal. But new, persistent discomfort deserves attention. A feeling that the bowel doesn't empty completely after a movement is another subtle sign. You may feel like you still need to go, even after using the bathroom. This sensation, when new and persistent, can indicate changes inside the colon. Unexplained fatigue is another signal that often goes unnoticed. This is not regular tiredness. It's a deeper fatigue that doesn't match your activity level. In some cases, slow blood loss from the digestive tract can lead to anemia, which causes fatigue, weakness, or shortness of breath. Unintentional weight loss is another warning sign. Losing weight without trying, without changes in diet or activity, is not something to ignore. It doesn't automatically mean cancer, but it does mean the body is under stress and deserves evaluation. Another symptom that is often overlooked is persistent anemia found on blood tests, especially iron deficiency anemia. Sometimes this is the first clue, even before digestive symptoms become obvious. One of the reasons colon cancer symptoms are missed is because they overlap with very common conditions. Irritable bowel symptoms, food sensitivities, stress-related digestion, and hemorrhoids can all cause similar complaints. The difference is not the symptom itself, but the pattern, persistence, and change over time. Colon cancer does not usually cause sharp pain early on. Waiting for severe pain is a mistake. By the time pain appears, disease is often more advanced. It's also important to understand that colon cancer does not only affect older adults. While risk increases with age, younger people can develop it too, especially with certain risk factors. Family history plays a significant role. If close relatives have had colon cancer or polyps, screening may need to start earlier. This is not about fear, it's about timing. Lifestyle factors also influence risk. Diet, physical activity, smoking, alcohol use, and chronic inflammation all play a role over time. But even people with healthy habits can develop colon cancer, which is why symptoms should never be dismissed based on lifestyle alone. Now let's talk about testing, because this is where fear often takes over unnecessarily. Testing is not a diagnosis. Testing is information. It's a way to rule things out, catch changes early, and reduce risk. Screening tests are designed to find problems before symptoms appear. Diagnostic tests are used when symptoms are present. Understanding this difference helps reduce anxiety. There are several testing options available, and not all involve invasive procedures. Stool-based tests can detect hidden blood or abnormal DNA markers. These are often used for screening in people without symptoms. Colonoscopy is the most comprehensive test because it allows direct visualization of the colon and removal of polyps during the same procedure. Polyps are growths that can become cancer over time, and removing them prevents cancer from developing. The idea that testing is something to fear is outdated. Modern procedures are much safer and better tolerated than many people imagine. The fear usually comes from stories, not from reality. Knowing when to get tested depends on age, family history, symptoms, and overall risk. For many people, routine screening begins at a certain age, even without symptoms. For others, testing is recommended earlier because of risk factors or warning signs. Waiting until symptoms are severe defeats the purpose of early detection. Colon cancer is highly treatable when found early. That's the part that often gets lost in fear-based conversations. The goal is not to assume the worst. The goal is to listen to changes, take them seriously, and use testing as a tool for reassurance or early action. Most people who get evaluated do not have cancer, but those who do benefit enormously from early detection. The body communicates through patterns. Changes in digestion, energy, weight, and elimination are not random. They reflect internal processes. Learning to notice these changes without panic allows you to act calmly and effectively. Colon cancer awareness is not about living in fear of symptoms. It's about respecting your body enough to investigate when something is different. And as you become more familiar with what is normal for you and more attentive to changes that persist, you give yourself the chance to address issues early, reduce risk, and replace fear with clarity, continuing to build a relationship with your health that is based on awareness, timely action, and trust in your ability to respond wisely when your body asks for attention. And that trust in your ability to respond wisely is one of the most powerful tools you have when it comes to colon health. Many people ignore early changes not because they don't care, but because they don't want to overreact. They tell themselves they'll wait a little longer, change their diet, reduce stress, or see if things improve on their own. Sometimes they do, but when changes persist, waiting becomes a risk rather than a solution. Another reason symptoms are overlooked is because digestive issues are so common. Bloating, irregular bowel movements, gas, and discomfort affect a large part of the population. Over time, people normalize these sensations and stop questioning them. The problem is not having occasional symptoms. The problem is when something changes and stays changed. Pain is not a reliable early signal in colon cancer. Many people assume that cancer must hurt, but early colon cancer often causes no pain at all. That's why relying on pain as a trigger for action is misleading. The colon can be affected for a long time before pain appears. Another subtle sign some people experience is increased urgency. Feeling a sudden, strong need to use the bathroom, especially when this is new, can be related to changes in the bowel. This urgency may come with very little stool or may not relieve the sensation afterward. Mucus in the stool is another sign that is often ignored. Occasional mucus can happen with irritation or infection, but persistent mucus, especially when combined with other changes, deserves evaluation. Some people notice that their bowel movements become more frequent or less frequent without a clear reason. Again, it's the persistence that matters. A few days of change is usually not concerning. Weeks of change are. Another overlooked symptom is abdominal distension that doesn't fluctuate much. Feeling constantly bloated or full, even without eating large meals, can be a sign that the bowel is not functioning normally. Colon cancer can also affect appetite. Some people feel full quickly or lose interest in food without understanding why. This change is often subtle and gradual. There is also the issue of iron deficiency that doesn't improve with diet or supplements. When iron levels remain low despite adequate intake, blood loss from the digestive tract is one of the possibilities that should be considered. It's important to remember that having symptoms does not mean you have cancer. Most people with these symptoms do not, but symptoms are the body's way of asking for attention, not diagnosis. Testing is often delayed because people fear the process more than the outcome. They imagine discomfort, embarrassment, or bad news. In reality, most tests are brief, controlled, and focused on prevention and reassurance. Stool-based tests are simple and non-invasive. They can be done at home and provide valuable information. They are not perfect, but they are useful tools. Colonoscopy, while more involved, is a preventive procedure as much as a diagnostic one. Removing polyps prevents cancer from developing. Many people who undergo colonoscopy never develop colon cancer because of this early intervention. Sedation makes the procedure comfortable for most people. The anticipation is often worse than the experience itself. Another fear is what happens if something is found. But finding something early gives options. It gives time. It gives the opportunity for less aggressive treatment and better outcomes. Avoiding testing does not avoid disease. It only avoids information. Age recommendations for screening exist because risk increases over time, but symptoms override age. If symptoms are present, testing should not be delayed because someone feels too young. Family history should always be shared with healthcare providers. Many people don't realize how much this matters for timing of screening. Lifestyle factors influence risk, but they don't cancel it. Healthy habits reduce risk, but they don't eliminate the need to listen to symptoms. Colon cancer awareness does not mean living in constant worry. It means being familiar with your own baseline and respecting changes that persist. The goal is calm vigilance, not fear. Curiosity, not avoidance. When you respond early, you often find reassurance. And when intervention is needed, it is usually simpler and more effective. The body gives time. It gives signals quietly, long before emergencies arise. Listening to those signals is an act of self-respect. And as you continue paying attention to patterns in digestion, energy, and overall well-being, you build confidence in your ability to recognize when something deserves evaluation, allowing you to move forward with clarity rather than fear, and to treat testing not as something to dread, but as a tool that supports long-term health and peace of mind, while you continue learning how your body communicates its needs over time. And that shift from dread to understanding is crucial because fear often keeps people stuck. When fear dominates, people delay, avoid, or rationalize symptoms away. When understanding takes its place, decisions become calmer and more timely. Another point that deserves attention is how long people wait before considering evaluation. Many individuals live with changes in bowel habits for months or even years before mentioning them. They adjust their routines, plan their days around bathrooms, avoid certain foods, or accept discomfort as normal. These adaptations are quiet signals that something has changed enough to affect daily life. Another subtle sign that's often overlooked is variability that feels unpredictable. One day things seem almost normal, the next day they don't. This inconsistency can falsely reassure people because symptoms are not constant. But fluctuating symptoms can still indicate an underlying issue. Some people also notice increased gas with a different odor than usual. This is uncomfortable to talk about, but changes in gas patterns can reflect changes in digestion or bacterial activity in the colon. While this alone is not diagnostic, persistent changes deserve attention. Colon cancer symptoms are often mistaken for food intolerance. People remove food after food from their diet, trying to control symptoms, sometimes without success. When dietary changes don't resolve symptoms, that's an important clue. Another sign that often goes unnoticed is discomfort that improves briefly after a bowel movement but quickly returns. This pattern can indicate that something is affecting bowel mechanics rather than simple constipation or diet. Some people feel a vague pressure in the lower abdomen or pelvis, not sharp pain, just a sense of fullness or heaviness. This can be easy to ignore, especially if it doesn't interfere with activity, but persistent pressure is worth evaluating. There's also a psychological layer. Digestive symptoms are often embarrassing, so people avoid discussing them, even with healthcare providers. Silence becomes a barrier to care. Normalizing these conversations is part of prevention. Testing is not a failure of self-care. It's an extension of it. Getting checked does not mean you've done something wrong. It means you're responding appropriately to information your body is giving you. Another important concept is that screening guidelines are based on populations, not individuals. Symptoms always matter more than age cutoffs. If something feels different and persistent, it deserves attention regardless of age. Some people believe that if they feel generally well, nothing serious could be happening. But early colon cancer often does not affect overall well-being dramatically. Feeling okay does not rule out problems. Blood in the stool is sometimes invisible. Occult bleeding can occur without visible blood. This is why stool tests exist. Relying only on what you can see is not enough. Iron deficiency anemia, especially in men and postmenopausal women, should always prompt evaluation of the digestive tract. Treating anemia without looking for a cause can delay diagnosis. Another factor is access to care. People sometimes delay testing because of logistics, cost concerns, or lack of time. While these barriers are real, awareness helps prioritize health when choices must be made. Colon cancer outcomes have improved significantly because of screening and early detection. This is one of the success stories of preventive medicine, yet fear still prevents many people from benefiting. The idea that not knowing is better is a myth. Knowing gives options. Knowing gives time. Most colon polyps never cause symptoms. That's why screening is so effective. Removing polyps prevents cancer before it starts. When symptoms are present, evaluation shifts from prevention to diagnosis, but early diagnosis still offers excellent outcomes. The body is not trying to scare you, it's trying to communicate. Changes in digestion are among its quieter signals. Learning to notice these changes without jumping to conclusions allows you to respond thoughtfully rather than react emotionally. And as you continue developing that awareness, you may find that conversations about digestion, testing, and prevention feel less intimidating and more empowering, helping you approach your health with clarity, responsibility, and confidence, while continuing to listen closely to the patterns your body uses to ask for attention long before serious problems develop. And that confidence grows when you realize that most evaluations lead to reassurance, not bad news. People often imagine testing as a doorway to worst-case scenarios, but far more often it's a doorway to clarity. Clarity reduces anxiety because uncertainty is usually more stressful than answers. Another aspect that's rarely discussed is how chronic stress affects bowel symptoms and how that can blur the picture. Stress can absolutely alter digestion, bowel habits, and gut sensitivity. This is why many people assume their symptoms are just stress. But stress does not exclude other causes. In fact, stress can coexist with physical changes, and assuming one cancels out the other is a mistake. What matters most is whether symptoms change when stress improves. If bowel changes persist even during calmer periods, that's a signal to look deeper. Another subtle sign is waking up at night to have a bowel movement. The digestive system is usually quieter at night. When bowel urgency or movements regularly disrupt sleep, that is not typical and deserves evaluation. Some people notice increased discomfort after bowel movements rather than relief. This pattern can feel confusing and is often ignored. But discomfort that doesn't follow the usual rhythm is worth paying attention to. There is also the issue of unexplained back pain combined with bowel changes. While back pain is common, when it appears alongside digestive symptoms and doesn't respond to usual measures, it adds another piece to the picture. Colon cancer symptoms can overlap with inflammatory bowel conditions, infections, or benign growths. This is another reason testing is valuable. It helps distinguish between possibilities rather than leaving you guessing. Testing is not about labeling. It's about narrowing down causes and choosing the right next step. People sometimes worry that talking about symptoms will automatically lead to invasive procedures. In reality, evaluation often starts with simple steps: history, blood tests, stool tests. More involved testing is based on findings, not assumptions. It's also important to remember that modern screening recommendations exist because they save lives. Colon cancer rates have decreased in groups that participate in regular screening. This is not theory, it's observed reality. Another common barrier is embarrassment. Digestive symptoms are still considered taboo, but healthcare professionals discuss these issues every day. For them, it's routine. For you, it's personal. That mismatch often makes people stay silent longer than they should. Normalizing conversations about bowel health is part of prevention. Digestion is not separate from the rest of the body. It reflects overall health. Another point worth mentioning is that symptoms don't need to be severe to be meaningful. Mild symptoms that persist are just as important as intense ones that appear suddenly. People often ask how long is too long to wait. There is no exact number, but as a general rule, changes lasting more than a few weeks, especially if they are new for you, should be discussed. Waiting for symptoms to become unbearable is not a strategy. Early evaluation is easier, less stressful, and more effective. Colon cancer is one of the most preventable cancers because of how it develops. Polyps take years to become cancer. That long window is an opportunity. Fear narrows thinking. Information expands it. When you replace avoidance with curiosity, you move from feeling powerless to feeling engaged in your health. Listening to your body does not mean assuming the worst. It means respecting signals enough to ask questions. And as you continue learning to observe changes calmly, to separate fear from facts, and to use testing as a tool rather than a threat, you build a stronger relationship with your health, one where early action becomes normal, conversations feel easier, and long-term well-being is supported by awareness, not driven by anxiety, while remaining open to the next steps your body may be guiding you toward. Subscribe to the channel and turn on the notification bell so you don't miss future videos where we talk about health in a clear, calm, and fear-free way. Share this video with someone who might need to hear it, leave your questions or experiences in the comments, and join me as we continue learning how to listen to the body, recognize early warning signs, and take timely action to protect long-term health.